What you don't know about back pain could hurt you. Hey everybody, this is Mike Erlob and you're on another episode of Power Your Life. What you don't know about back pain could hurt you. This, I often hear this from a lot of my patients, and it's just they just ask the same question. It's, Mike, when should I get help for back pain? This is a common question, and it really has a lot of valid concerns. You see, most of us, we don't know when we should seek help. We don't know when this little ache or this little pain is just going to maybe go away on its own. Because let's face it, those of us that are getting older, every day it seems like, me included, I wake up with this new ache or new pain somewhere, and I just don't run, to the doctor every single time that I feel something. It tends to kind of work itself out. And I think with back pain, for most of us, that's the same thing. We don't run to the back specialist for every little ache and pain. I get it, because just like I said, I am the same way. Like a lot of my clients, and myself included, I used to think at times, I just ignore it. I'll just ignore it and it'll go away. But you see, ignoring it, this way of thinking rarely works. In fact, ignoring the pain is the fastest way to get yourself into trouble. I want to share a story about a former patient of mine, and his name is George. And now that's not his real name. I'm trying to protect his identity. But George, he was a client of mine, and he had back pain on and off for several years. And he even admitted to me that when this would flare up, he would usually ignore it. And so he'd go through these flare-ups generally a few times a year, but he would ignore it, and eventually it just would go away. And but then the thing he noticed was that this back pain that he was getting, it would return after several months. And each time that the pain returned, it got a little worse. And not only did it get a little worse for him, but it also seemed like the length of time that he had the pain, it was getting longer. And so, he knew deep down that this was not going away. And you see, George, he was a teacher. And, what would happen is when he would have these flare-ups, he would miss class for several days. And it got to the point where he started having trouble even standing upright. And then eventually he couldn't even sleep through the night. Now, for those of you that work in education, I think you know that it is very hard to teach if you can't stand up. It's very hard to interact with your classroom. And it was just, for George, it was really hard for him to do his job. When he couldn't get himself upright, he just had to stay home. And I think the biggest thing for him was once it started to progress into the point where he just wasn't sleeping and he couldn't get more than a couple hours of sleep through the night, and he was just waking up completely exhausted, that's when he finally decided to do something. But what really was the straw that broke the camel's back for him was the day when he woke up and he could not stand upright. He couldn't get himself into a locked upright position because that pain was so intense. And so he started to have to he was using a walker. And, for him, this was really frustrating. And it was scary because he was only 42 years old. And so, he had this frustration and, worry. He couldn't sleep. He couldn't walk. Getting in and out of the car for him was just absolutely excruciating. If you've ever had any back pain, you know that when you go to sit down and turn your body into the car and you have to bend your head down in order to clear the doorway there, how bad that can make it hurt. And, for him, that was one of the main things he wanted to work on when he came in for therapy, was just getting in and out of the car. The other part, he got to the point where he couldn't put on his socks and shoes. He couldn't bend over. He could not slip his own socks and shoes on. And so he just had to wear Birkenstocks. He had to wear slip-on sandals because that was the only thing that he could, slide on, slide off without causing excruciating pain. He started getting really concerned. He was really worried that, he wouldn't be able to return to work, let alone, do yard work, housework, or, even play with his 10-year-old son. This started to spin into where he started to slip into a depression. And then along with that depression, he started having anxiety with panic attacks. And, that's probably when it was just really, really scary for him. I know he told me on numerous occasions, he just felt like he was letting everybody down. He felt that he shouldn't be having this kind of problem at 42 years of age. And he felt that he wasn't, filling his role as a teacher, as a father, as a husband. It was just, everything seemed to be spinning out of control for him. Every day was a constant struggle. Now, it took him several months, but he was able to eventually gain his ability to be able to stand, walk, and then get in and out of the car. And then eventually, he made a full recovery. But he had missed so much work up to that point that he nearly lost his job. And I still remember George asking me, he said, he goes, he always looks back at things like we all do. And he said, what could I have done to avoid it getting this bad again? And he was thinking for the future too. He wanted to know, what are the warning signs? What are the signs that say, hey, this is something that's mild and it's going to go away, or, oh my gosh, this is something I need to get on top of right now. He told me, and he just said, he just didn't know when he should see someone. He didn't want to be a complainer, and he really just didn't think it was that serious until it really started to spiral out of control. Now, if you're like me, most of us are just like George. We just don't know when we should get help. But I want to cover that with you because there are several facts about back pain that you should know. And the first one is back pain usually gets worse over time unless you start fixing it naturally. You see, sometimes that pain will go away, but it does not mean that your spine is getting better. It just means that little bit of exacerbation that you're going through, that acute inflammation, your body has kind of taken care of it. But the problem that is causing that is still present. Back pain rarely gets better on its own. Now, your body will try and protect itself. And what it will do is it'll lay down calcium deposits in through the spine in an effort to stabilize these problematic areas. But what happens is this leads to what we call osteophytes, which osteophytes are nothing more than bone spurs. So this will lead to bone spurs and eventually early arthritis. And that pain may decrease for a time because as the body lays down the calcium around the vertebrae and then it temporarily stabilizes it, that does get used to where it starts to stiffen the joint to where it actually takes that pain away. And so the pain may decrease for a time, but it typically comes back. And when it comes back, boy, it's like George, it comes back with a vengeance. So here is when you should worry. Okay, so the first thing you should look for is if you're having back pain is if you start losing flexibility in your hamstrings. Now these are the muscles in the back of your legs. So you start noticing that trying to touch your toes is harder and harder. Now you may be tight to begin with. That is not that abnormal for your hamstrings to be tight. It's when they're getting tighter. Okay, so you're losing the flexibility that you had. Where maybe you couldn't touch your toes, but you could bend over and get maybe halfway down your shin. And now all of a sudden your back hurts and you start noticing that you can't touch past your knees. Okay? That's when you need to start to worry and you need to take action. Also, if you have difficulty getting in and out of your car, so that's number 2. So if you have trouble getting in and out of your car, especially you're losing that flexibility in your spine to be able to flex as you get in, you need to start to worry. The third thing is if getting out of bed is a chore. Okay, now I'm not saying getting out of bed in the morning because you're tired. I'm talking about your back pain. So if your back pain gets worse in the morning to the point to where you are having more trouble getting out of bed. You get out of bed, your back feels really stiff, you have trouble getting upright, then you need to start to worry. The fourth thing is pain starts shooting to other parts of the body. All right, so if it starts going into your hips, into your buttocks, if pain starts going down your leg, you need to take action. If you get any numbness in the toes or leg, that's a definite red flag. You definitely need to get help. Pain in the groin. Okay, so if you start, we call it the saddle region. So if you can imagine like you're riding a horse, and that area in through the groin and underneath that would be in contact with the saddle region. If you get pain in that area, you definitely need to get some help. If you have difficulty urinating or you have pain while having a bowel movement, okay, so you get more back pain while going to the bathroom, definitely need to get checked out. And the last red flag is if you're developing any weakness in the toe, ankle, or knee, you definitely, you need to seek help. Whether you go to a physical therapist or your doctor, you need to get it checked out. Now, these signs, they all can mean that your back pain is leading to nerve damage or irritation. This means that it's time to seek a professional and start taking action, or it could really lead to bigger problems. Just like it did in George's case. And so many times I see my clients in the clinic that if we could have gotten to them just a little bit earlier, we could have greatly shortened how long it was going to take to get them better. So, I just really want you to hope this resonates with you, because I really hope this can help you make a good decision on, when you should get help for your back. Which, by the way, reminds me, if you would like more information on what you can do for your back, just shoot me a Facebook message, or you can even email me at mike@flex-pt.com and just ask for a copy of my free ebook, The 5 Best Kept Secrets for Fast Back Pain Relief. It's got a lot of great information that can be really useful in helping you get your back better. So until next time, I want you to stay healthy and keep moving forward.